Assalamu alaikum. Spinal cord is a part of the body that usually loads the pressure of the whole body. But sometimes this pressure increases on the spine, which may cause the morphological changes of the spine. So today we will discuss increased pressure on the spine and what are the cause behind that. I'm Dr. Sayeed, Senior Consultant Neurosurgeon and Head Medical Service Wing, Center for the Rehabilitation of the Paralyzed. Usually our head, it has its own weight and it is 10 to 12 pounds. So in the normal posture, it gives nearly 10 to 12 pounds on the spine. But when our head little bit forwards, what happens? You can see this 12 pound increases up to the 32 pounds for the 2 inches forward of our head. But when it increases only 1 inch, that means our head goes 3 inches forward to the normal straight position. The weight increases from 32 to 42. That means for 1 inch it goes 10 pounds. So for every inch of forward head posture, it can increase the weight of the head on the spine by an additional 10 pounds. So this is very important to keep our head straight whenever we do some works or whenever we walk, even whenever we sleep. If someone uses the pillow, high pillow, then it looks like that his head is forwarded because pillow will go in this side. If the pillow is high, so the head will go forward. If the pillow is higher, then it goes more forward. So the same condition could be happening, but little difference because it is an erect posture and that is the spine posture. But the curvature causes the pressure on it, even in the lying position. A new study suggests that looking down at a cell phone, it is the equivalent of placing a 60-pound weight on one's neck. This image is very interesting, and the study also is very interesting. Forces on the neck increase the more we tilt our head, causing spine curvature. You can see here, when we are in the neutral position, our force on the neck is 10 to 12 pounds. But when neck tilt 15 degree, it increases nearly 3 times. That means 27 pounds. Increase up to another 15 degree, that means 30 degree, it increases 4 times. When 45 degrees, it increases nearly 5 times. When it is 60 degrees, it increases 6 times. So in the normal neck tilting, that means 0 degree in the straight position, we have 10 to 12 pound force on neck. But every 15 degrees tilting, it increases more and more. So 15 degrees, it increases 3 times, for 30 degree 4 times, 45 degree 5 times, and 60 degrees 60 pound, that means 6 times of the normal neck tilting. This 60 pound is roughly the weight of 4 adult sized bowling balls or 6 plastic grocery bags worth of food, or yes, an 8 years old. It comes in the journal Surgical Technology International. The researcher's name Kenneth Hansraj. He is a New York back surgeon who found this figure using a computer model of a human spine. An average human head weighs about 10 to 12 pounds, already I mentioned it, and tilting it down to check Facebook or send a text or to Google search, the weight of an human head increases the gravitational pull on said cranium. This is called text neck syndrome. This is not new, but the affected case is increasing day by day because of the mobile user, because of the computer user. So forward head posture can cause permanent damage, and eventually it results in headaches. We call it cervicogenic headache. The headache, you can feel the pain in the front of the head, sometimes in the two lateral sides, temporal region, sometimes the whole neck and the occipital regions. So it depends. So we call it cervicogenic headache. And this forward head posture can cause permanent damage to the spine, so causes the back pain, even the muscle damage or muscle wasting, nerve damage, because all the times there is a compression on the root, and sometimes because of the long-term pressure the discs become degenerative, and so the discs could be herniated and spinal disc compression is there, and spinal curvature is altered. Sometimes there is gastrointestinal problem, onset of early arthritis, loss of lung volume, capacity, and so on. So this is text neck syndrome. It comes because when we text a message SMS to someone, we bend our head, we tilt our neck. So this is called the text neck syndrome. Not only the neck, body position affecting the spine also. So look at the figure. When we are in the lying position, there is a pressure in our disc. We call it intradiscal pressure. This is nearly about 25 kilo. But when we turn on our side from the supine position, it increases 75 kilo. When we stand up in a straight position, we feel no pain, but still there is much more pressure, 100 kilo. And when we forward a little bit, we bend a little bit forward, it just increases 150 kilo. If someone is bends and take any loads or heavy things that we're lifting, it goes 220 kilos. Even in the sitting posture, we have the pressure on our disc. Straight position, it is 140, but when you are leaning little forward, it goes up to 185 kilos, huge. And when you become more forward to lift any weight, it becomes 275. So this position and this position is very crucial. We usually use our laptop or our office work in these conditions. So this is important. Think about your body position, because body position affect the spine disc pressure. Factors which may contribute to disc pain or degeneration within the lumbar spine. It includes lack of fitness, heavy lifting of objects, operating motor vehicles, prolonged sitting, the doctors, the office workers, the clerks, even the teachers, and operating the vibrating tools. And the most worst thing is the history of smoking, which is known to cause disc degeneration. Job dissatisfaction and or lack of interest in our profession are psychological factor that may also play a role in the development of lower back problem. So this is the picture. It shows what is the normal disc. You can see the normal disc height and weight, and the texture is normal, but there is a linear fracture line, looks like a fracture line. It is called a degenerative disc, and there is a little bulging is there. You can see there is a bulging, so we call it bulging disc. Still the annulus fibrosus, it is intact, but there's a little bulge, so we call it bulging disc. And when it tears and the nucleus pulposus, that means inside gel comes out through that fracture, to that tear side, so we call it herniated disc. And when the pressure increases, slowly the discs become thinning. The types of spinal fracture: long-term pressure or some accidents causes the fracture of the spine or vertebra. Different types of fracture: there is a compression fracture, there is a wedge type of fracture, and there is burst type of fracture. All fracture are serious, but the most complicated fracture is the burst fracture usually. And due to the wedge shape fracture, what happens? The spine become spine's alignment is distorted, so usually the kyphosis happening because of the wedge type of fracture. What is your opinion about these pictures? The picture says everything I need not to explain. And look, this is a real picture. From the very childhood, we destroy our child's spine. Weight gain and back strain. Weight gain, back strain. So increase in the weight, it causes the pressure on your spine, and the spine curvature is changed, so there is a pressure. You can see slowly the weight is increasing, the belly is increasing, so their curvature is changed. When the curvature is changed, the pressure is increasing. So weight is another important thing. Here is a picture. It also denotes how weight causes the pressure on your spine. Even in the healthy weight people, they have the systemic inflammation level, low systemic inflammation level. When your body weight is increased, you are in the obese type, so your systemic inflammation level is high, and there is a mechanical stress on your spine, and your muscle strength become weak. When you are morbidly obese, your systemic inflammation level will be very high, and there is a huge mechanical stress on your spine and your legs, and obviously your muscle strength will be decreased so much. This is an interesting thing. A new study reveals increase on one cup size adds nearly 10-pound strain on spine. This is the same researcher, Dr. Kenneth K. Hansraj, unveils significant impact of breast forces on the spine by as much as 110 pounds It comes in the Journal of Surgical Technology International, New York, April 2006. You can see the breast force on the spine, and according to the new study, women opting for breast augmentation will be increasing the impact of strain on their spines by as much as 110 pounds. Women with an increased body mass index who experience a weight gain resulting in a large bust are also victim to developing thoracic spine pain. Additional culprits in further promoting the damage including the poor posture, which may magnify or worsen the problem, incorrectly sized bras, and natural bone weight weakening effect over time. So many in the Western countries, many females, they come to the plastic surgeons to augment their breast, to increase the size of the breast, but they don't know, or sometimes the plastic surgeons or the surgeons, even they do not explain that what could happen if the breast is augmented and the breast size is increasing, what will happen on their spine. So most of them, they have the pain on their back because of their increased body mass index, increase the bust size. So what to do if there is an increased pressure on our spine? What should we do? We have to focus on three things: our food habit, our sleep habit, our exercise habit. I'll not talk too much more about the other things, but these three things is very important. If we manage these three things, we can manage our whole life. So this is not the one thing. We have to focus these three things to make our life a healthy life, to lead a healthy lifestyle. So in my next video, I will explain one by one what is the healthy food, what is our food, what should be our food habit, how is the sleeping pattern, and what are the exercise that may improve our general conditions. After that, thank you very much. This is the Corona time. You know, everyone is alert about these things. The whole world never faced this type of crisis anytime after the Second World War. So keep yourself in your home, stay home, and be safe. And please maintain all the precaution, and do the hand wash every 30 minutes with your soap water or sanitizer. And whenever you have the sneezing or coughing, please keep your hands with handkerchiefs, and be safe, and let the other safe from yourself. Thank you very much being with us.